Hello everyone, this is a group 4 case presentation about the box mobile health device implementation. The box is a type of mobile health device which is developed to monitor vital signs at home, especially for the cardiac patients. This box mobile health consists of various apparatus such as a blood pressure monitor, weight scale, podometer, which is an activity tracker, sort of wristwatch type, thermometer, a live core cardia. This is a ECG device with a single lead, cardio secure. This is also a ECG device with 4 electrodes, pulse oximetry to measure heart rate and blood oxygen saturation. All these devices are smart or connectable via Bluetooth or through a wire to record each measurement. Developed in 2016 and introduced in outpatient care in Department of Cardiology at a large tertiary medical center in Netherlands. And at the time of implementation, it is believed to increase patient engagement, improve clinical outcome, and reduce health care costs. There are many studies conducted about its nature and effectivity. One of the evidence-based study article about the box is the box real-world experience of mobile health implementation in clinical practice, which is published on JMIR 2021. The authors are Tom Briestker, Alexander Helt, Inno van der Veld, Martin Jan Schulz, Roderick William Triskes. All are from the Department of Cardiology, Leiden University Medical Center, Leiden, Netherlands. Among the authors, the first one is Tom Briestker. He has MD and PhD, cardiologist. His previous work include impact of mobile health device for the detection of atrial fibrillation, a systematic review published on JMIR in 2021. His second study was a mobile health versus standard care after cardiac surgery, result of the box 2.0 study published on Aeropass in 2023. His third study was pre-hospital triage of patients with acute cardiac complaint, a study protocol of heart, a multi-center prospective study published on British Medical Journal in 2021. His fourth study was mobile health for cardiovascular risk management after cardiac surgery, result of sub-analysis of the box 2.0 study published on European Heart Journal Digital Health in 2023. His fifth work was use of smart technology for the early diagnosis of complication after cardiac surgery, published on JMIR in 2020. The second author is Alexander Health. He has MD, PhD. He is a cardiologist. His previous work include first, teamwork and safety attitude in complex aortic surgery at Dutch Hospital, cross-sectional survey study published on JMIR in 2020. His second study was perspective of patient and professional on information and educational after myocardial infarction with insight for mixed reality implementation, a cross-sectional interview study published on JMIR in 2020. His third study was a prospective virtual reality app for patients scheduled for cardiac catheterization, pre-post questionnaire study examining feasibility, usability, and acceptability, which is published on JMIR in 2022. The third author is Ino van der Veld. He is a PhD holder. He is an experienced medical physicist with demonstrated history of working in the hospital and healthcare industry, skilled in medical device, HL7 standard, healthcare information technology, HIT, picture archiving and communication system, PACS, and biomedical engineering, currently working at strong healthcare service professional with PhD focused in cardiology, Leiden University Medical Center, Leiden, Netherlands. His previous work include 1. Mobile health for central sleep apnea screening among patients with stable heart failure, single cohort open prospective trial, published on JMIR in 2019. His second study was using smart technology to improve outcome in myocardial infarction patient, rationale and design of protocol for randomized control trial, published on JMIR in 2017. His third study was the box eHealth in outpatient clinic follow-up of patient with acute myocardial infarction, cost utility analysis, published on JMIR in 2022. The fourth author is Martin Jane Schilch. He has MD, PhD. He is a cardiologist. His previous work include 1. The box eHealth in the outpatient clinic follow-up of patients with acute myocardial infarction, cost utility analysis, published on JMIR in 2022. His second study was using a smart technology to improve outcome in myocardial infarction patient, rationale and design of protocol for randomized control trial, published on JMIR 2017. His third study was a mobile health for central sleep apnea screening among patients with stable heart failure, single cohort open prospective trial, published on JMIR in 2019. The fifth and the last author is Roderick Wilm-Tresques. He is a postdoctoral researcher at Leiden University Medical Center, Leiden, Netherlands. His previous work include 1. Using a smart technology to improve outcome in myocardial infarction patient, rationally and design of protocol for randomized control trial, published on JMIR in 2017. His second study was the box eHealth in the outpatient clinic follow-up of patients with acute myocardial infarction, cost-utility analysis, published on JMIR in 2022. His third study was a mobile health for central sleep apnea screening among patients with stable heart failure, single cohort, open prospective trial, published on JMIR Cardio in 2019. The purpose of the study article is to outline the design of box and its implementation and use in the outpatient clinic settings. It presents the result of 4-year structural implementation, logistical and clinical process, as well as reported patient and physician satisfaction. The hypothesis of the author is the box mobile health device increases early detection of abnormality as well as increase patient satisfaction and empowerment by introducing patient home vital sign monitoring and replacing physical outpatient clinic visit by digital visit via the webcam. The method utilized during the study are as follows. The box mobile health implementation evaluation study is conducted at the cardiology department of the Leiden University Medical Center, which delivers tertiary or advanced care of cardiovascular patients. The study was randomized controlled trial. The study groups are patients who underwent cardiac surgery and advanced cardiac disease. This study began recruitment patient in November 2018. These patients individually received installation instruction of the box device from technical assistant and relevant apps were installed and all devices were connected to the patient's smartphone via Bluetooth. A nurse practitioner handled follow-up via video consultation and monitored patient's data via online dashboard integrated with the electronic health record. Each patient group had their own nurse supervised by cardiologist. The nurse contact patient if trends of data indicate any abnormalities. The video consultation are with regard to discuss topics such as symptoms, side effects of medication, technical issues, and so on. It is believed to be comparable with physical outpatient clinical visit. The professional and patient user experience feedback was obtained via structured interview.
For the box project, there was a count of 1,140 patients that were using the app due to their cardiovascular disease. So that includes myocardial infarction, cardiac surgery, infratrial fibrillation, device patients' heart failure and patients with congenital heart failure. Out of those patients, majority were male, ages 60 years old. But in the interview process was between 2017 to 2019. Majority of the patients that did the interview were in 2017, some were in 2018, and the least of the 24 were in 2019. 33% of the patients um, did want an improvement with the app, but majority of the patients were also satisfied with using the Box app. Most patients gave positive feedback for the Box app. A lot of them stated the Box was easy to use as far as the medical devices and using it towards the app. Someone stated, I know more about the illness now that I'm learning normal blood pressure values and ECG readings from taking daily measurements. Another one about the devices that were used towards the app. I feel more confident in my body since the use of the mHealth devices. Um, Another one also said, I better understand now the patients have responsibility in their rehabilitation. The box is a tool that helps me do so. So a majority of the people that left the feedback was in regards of how they were using the medical devices and how it was implemented into the app. And they also learned more about their cardiovascular disease or cardiovascular conditions, because some of the cardiovascular issues that are going on here aren't just diseases, but they are um, just complications, and they were able to understand those complications. And as a patient, it's important to understand um, your body and how to um, regulate it, and also understand how to take care of your body better. There were some negative comments about the Box app, but most of those negative comments were, just the usability of the app and how it wasn't individualized as much. So, some of the negative comments about the app, I would have preferred a feedback system which reassures patients that measurements are looked at. Another one said the box confronts me with my illness on a daily basis. So another one is the box is too big. It does not, another one said it does not feel like the box connects seamlessly with other rehabilitation programs. So like I said, the usability of the app, it has to be human centered and very individualized for the patient. If the patient feels like uh, it's not effective towards them, it's not going to leave a positive impact on their life, and they're most likely not going to use it. So for most cases, the negative feedbacks were, um, you know, um, some of them were from the providers. So like feedback as far as like understanding the measurements and understanding like what am I looking for? Say for instance, they had a heart monitor. They're not understanding why is it so high, or it creates a form of trauma because someone also said it confronts their illness on a daily basis. We were not sure why that person is traumatized. So we have to be conscious of the information that's being given to the patient. Sometimes it's not understandable to the patient. Also with the negative comments, going back to the human centered, basically, it has to do with like mental confronting like the traumas and understanding how the human brain works. I wouldn't say mental health, but understanding how it may trigger a patient. So that has to play into part as using the app as well. So, as far as the results of the 24 patients that were interviewed for the Box project, it was broken up into the feedback of the installation, like how the patient installed the app and how efficiently, quality of the tech support, home measurements, and video consultations. So let's start off with the installations. All of the patients were successfully able to download the app before leaving the hospital. That's a good thing because that means whoever introduced the app made sure that they were aware how important it is to understand their condition. Um, 22 said it was too much information. Five had questions within a day of install. Three resolved issues via looking into the manual. Zero said it was too complicated to start. So it looks like majority of the 22 patients said it was too much information about the app or the installation that made it probably they didn't want to download it because it wasn't simplified enough for them to understand why they would have to download the app. Quality and tech support. 18 never contacted the help desk, which is a good thing. That means they were able to navigate the app efficiently. 6 contacted the help desk, so that's not a lot, but it's still quarter of the patients that called the help desk. So 18 preferred feedback on the measurements sent, which is a good thing because they're aware of the measurements or the calculations that were done on the conditions from the devices. So they did have questions. They did want to understand how the measurements were being taken. Um, home measurement. So it looks like majority of the patients, 19 reported it was very time consuming. And 17 empowered felt controlled over the illness. So that goes back to what I was saying about goes back to the overall results of like the comments of how to use the app. So with that being said, when someone is using a health app, they want it to be straight to the point. What are they looking for? They don't want to have to go too much into the apps just to figure out how to get the measurements and how to turn on the devices and to connect it to the device, so to the app. So it for some patients it could have been too much for them. Sometimes they just want it to be straightforward. 17 back to what I was saying, 17 empowered felt over controlled over illness. So with that being said, um, like going back to the trauma part, even though there weren't a lot of negative comments about um, being constantly reminded that they have an illness or they have a complication, um, could be traumatizing because you don't know exactly what the patient went through when they went through that form of trauma. So back to the usability of it, the human centered part of the app, like we have to make it as comfortable as possible for patients. And if that means that we have to implement some positive feedback as far as, what has been resulted of their measurements, it should be needed because sometimes if they're constantly seeing the same results over and over again and it's not good to a sense, if the provider said if their measurement reaches to a certain point and it's not a good thing, then it kind of becomes a discouragement for them to continue using the app. Video consultations. So majority of the patients completed the app. Only 7 didn't, and 5 out of those 7 patients had tech issues using the app. And 3 out of those patients also had another tech issue with using the app because the sound or video connection there was the issues with the app as far as like the connection, sounds, not understanding things, not understanding the problems. So for the user satisfaction results, overall patients liked how easy it was to use devices and ability to increase their education about their condition. So like I said before, most patients were satisfied with using the app, also navigating the app and with the devices that they were given before they were discharged from the hospital. But a very small minority stopped using the devices before the end. And it was because of some technical issues, like the connection to the device connection to the app to measure their vitals. And then, like I said before, just creating like a form of like introduced trauma from the past. So like sometimes when patients go through a traumatic experience, it could re-trigger what they went through. So say for instance, if somebody had a heart failure or heart attack and they're recovering and they have to use a device to monitor their symptoms, then in that case, it could resurface, like the trauma could resurface, and then it'll just create like discouragement or not wanting to use the app, because if they do see their vitals are above average or not where it should be, then it could have the patient like not want to use the app anymore. So I think for creating the app, it also has to still play into usability and user human centered application. So it has to be individualized. So even if they went through a trauma, I think the app should encourage the patient to continue to use the app, because maybe there could be some sort of like communication after from the provider, like letting them know that they're doing a good job, even though that the results came back abnormal. So these are things to just keep in mind as far as like what's recommended for the app. Also, for the provider using the app, one of the statements are using the box to measure their own vitals and increase patient engagement. So they were able to talk to the patient about the results. Also, the patient most of the patients had questions that were easy for the provider to answer, and they were both able to understand each other through medical terminology. So it's important that both provider and patient understand the results and how to better the results, I would say, their vitals in the next measurement. But one of the negative results or the negative impacts of the app is nurse practitioners had manually go through the large amount of recorded data on the dashboards, which took a great deal of time. So this is also important to know, is that once the provider gets the results, they want to be able to do something about it right away for the patient, or provide some sort of like feedback as far as like if they have like a really high abnormal result or a high vital, like say for instance high blood pressure. If their high blood pressure is super high, more than 140/80 or very above average, then they can direct the patient right away as far as what they need to do, if they need to go to the ER, if they need to be seen within the next 24 hours. So I think this is important to understand about the app.